Okay, my name is Bill Pezos, and I'm an exercise physiologist, and I'm the coordinator of the pulmonary rehab program at the University of Utah Hospital. I've been there for 16 years and actually started the program when they first started doing lung transplants, and also had a large number of patients who were interested in another type of lung surgery that was popular at the time, lung volume reduction surgery. They decided that a pulmonary rehab program was needed here, so I was hired to do that, and I've been here ever since. So today we're going to talk about exercise training for individuals with chronic heart and lung disease. I have a handout for you that you can pick up at the table on the way out. We will go ahead and get started here. So, this first slide shows why people come to us both before and after transplant. And that is that they have some kind of impairment with their particular disease process, whether with our lung patients it's emphysema or pulmonary fibrosis or cystic fibrosis, or whether it's heart patients with heart failure. There's some kind of symptoms that come on, and typically an individual starts noticing it with moderate exertion. So walking up a flight of stairs, walking uphill, doing some kind of activities of daily living, and they start thinking, you know, this is getting harder and harder for me to do, and it's a new situation for me. Typically, they won't seek medical attention right away, okay, because they may attribute it to something else that is reasonable. Well, I'm older, I haven't exercised in years, I've put on weight. Of course these things are going to be harder, you know, for one or more of those reasons. So they typically don't go to a doctor at first. One thing that does happen though is because of the symptoms, and the symptoms being uncomfortable as they are, whether it's shortness of breath, wheezing, coughing, chest pain, whatever, those symptoms start infringing on their ability to exercise, their desire to exercise, and not necessarily specific formal exercise, but really any kind of activity at all. So they start staying away from stairs, they start walking less, they start getting other people in the family to do chores around the house that they had typically done. So this leads to this downward spiral in functional ability, because along with that abstention from exercise and the disease itself, the person starts getting deconditioned. Okay? So muscles lose endurance, they lose strength. So now they've got two issues going on, whatever the issue is with the heart or lungs, but also the condition with the muscles. So if they continue to abstain from physical activity, then they eventually find themselves having those symptoms with mild exertion. So it doesn't take walking uphill or going upstairs anymore. Now just walking on level ground, trying to keep up with their husband or wife, they notice they can't do that. So further inactivity leads to deconditioning to the point of disability, and eventually they notice the symptoms with minimal exertion. Things that most people take for granted, just going to the bathroom, you know, taking a shower, making the bed, getting dressed, sometimes even talking. Sometimes when I call a new patient on the phone, because we've gotten a referral on them from a doctor for them to participate in pulmonary rehab, they have a hard time just talking on the phone and can't speak in complete sentences, have to speak in phrases. So the idea of rehab, whether it's cardiac rehab or pulmonary rehab, is to take an individual wherever they are in this downward spiral and to try to increase their functional ability as much as possible. So pulmonary and cardiac rehab are reconditioning programs to elevate that person's functional ability as much as possible. They're never going to be 100% again because of the disease, but with the muscles, we can, by reconditioning the muscles, we can regain a lot of functional ability. So this next slide tells why that works, why physical exercise helps people with chronic disease. And what we're seeing here is that it takes the heart, the lungs, and the muscles all working together, all working in unison to allow a person to perform sustained physical activity, okay? Muscles cause movement, right? Muscles contract, pull on bones, and we move. What is it that muscles need? They need fuel, which comes from the foods that we eat, the carbohydrates and fats, but they also need oxygen. Okay? Obviously, this is where the lungs come in. We breathe in air, the atmosphere, which contains oxygen. Then once the oxygen gets deep into our lung tissue, into those tiny air sacs that make up the lung tissue, oxygen transfers. It goes across that membrane into the bloodstream, into the tiny capillaries in the lungs. So now oxygen is in the bloodstream. Therefore, it's up to the heart at that point to transport the oxygen via the bloodstream to the muscles. So if a person has a deficiency in any of those three areas, whether it's chronic lung disease or heart disease or some kind of neuromuscular disease, we can expect to see a decline in physical capacity and functional capacity. By the same token, if we can improve any of those areas, we can see an improvement in functional ability, okay? Now, the easiest thing to improve is muscle function. Okay, muscles respond very favorably and pretty quickly to exercise. So they've done studies on elderly folks in nursing homes and see that, you know, 90-year-olds can improve their functional ability by, or improve their muscle strength by over 100%. You know, so we know that that works. And the heart's a muscle, so it can improve in its efficiency also in the way that the heart beats. So the heart can pump more blood with each contraction, with each beat, when the heart is in better shape, okay? So on that side of the equation, that's where we're really looking to help people out, okay? Because unfortunately, the lungs don't make the same kind of improvement that muscle does, okay? It's a common misconception for people to think that the lungs get in better shape with exercise. You hear it all the time. Somebody's, you know, walking with somebody else and they say, boy, since I started going to aerobics class, or I started, you know, whatever, exercising regularly, my lungs are in better shape. You know, I can go upstairs now easier. In fact, what's happening is that the muscles are in better shape, and it has an effect on your breathing and your need to breathe, but it's not the lungs themselves that are improving as a result of exercise, okay? You aren't going to get any more of those air sacs in the lungs as a result of exercise. You aren't able to your lungs aren't able to hold any more air or move air better or more efficiently as a result of exercise, okay? But the reason everyone experiences an improvement in their breathing as they get in better shape is because of the fact that it's the carbon dioxide that's produced by the cells of your body that really influences your breathing, influences ventilation. That is, how deep and how fast you breathe. And when you're breathing deeply and breathing fast, that's shortness of breath. That's a noticeable change in our metabolism there, and there's a level of discomfort to that, and we call it shortness of breath. Okay. So every cell in your body, as it uses oxygen to perform its function, the cell also produces carbon dioxide as a waste product, okay? And the muscles can really produce a lot of carbon dioxide because muscles are just so metabolically active. So if I were to start jumping up and down right now, it would only take a few seconds before you'd see me start breathing deeper and faster. And that's because I have to blow off the carbon dioxide that's being produced by those working muscles as I go from the resting state to the working state. So this is what the body uses. The amount of carbon dioxide in the bloodstream is what the body uses to determine how much do I need to breathe. Okay? So if we can improve the muscles as a result of exercise, progressive exercise, and exercise over a long period of time, then those muscles, as they improve in endurance and strength, then when you call upon those muscles to perform your daily activity, they won't be working as hard as they used to before you were exercising regularly. Therefore, they won't produce as much carbon dioxide, since they're not working as hard. Therefore, you won't get as short a breath. Okay? So exercise, once again, helps with shortness of breath, but it doesn't actually increase lung function. So if you do those breathing tests, you know, the breathing into the spirometer and you know, we're measuring airflow and everything, you won't see a noticeable change from pre-exercise program to post-exercise program. Exercise just isn't capable of doing that. Okay, so that's one reason that we do lung transplantation, you know, because when a person gets emphysema or pulmonary fibrosis, one of those chronic diseases, there's only so much that we can do for the lungs, and exercise, while it will help that end of the equation and help with functional ability, it's not going to restore lung function. And having a lung transplant is really the only thing that can do that. So exercise training then is this model of stress leading to adaptation. When you're exercising, when you're on that treadmill walking, your body is in a state of stress. Okay? But it's a good stressor because it's one that the body can make up for. That is, the body recognizes a need to be able to handle that stress better. So with the food that you eat, protein is used to make changes in the muscles and the blood vessels, in the heart muscle, and changes take place, these adaptations take place that we refer to as getting in shape. So there needs to be enough stress to cause the adaptation to take place. You know, we've all seen people walking around the neighborhood and they're walking their little doggy and, you know, they're stopping, you know, in every person's yard for the dog to sniff around or stopping to talk to neighbors and everything. So the person's out getting, you know, some fresh air and sunshine and all of that, but they're not really exercising because there's not enough intensity there, there's not enough stress to cause the body to make physiological adaptations that we would call, you know, getting in shape or improving our physical conditioning. Now, when we talk about the benefits of exercise training, we can categorize them into health benefits and fitness benefits. Okay, so the most obvious health benefit is longevity. We want to live as long as we can, right? And people who exercise tend to live longer than people who don't exercise. That's true for the apparently healthy population, and it's true for a number of disease populations also. Then exercise improves cardiovascular endurance, so this is what we were just talking about, the heart, the lungs, the muscles all working together. Exercise helps to do that. So improving the function of the heart muscle itself is what we've referred to as a central adaptation, and the peripheral adaptations are improvement in muscle endurance, improvement in the vasculature, the capillaries that feed the muscles, and components of the muscle cells themselves. improvement takes place at all of those levels. Anaerobic threshold, that's both of those terms, VO2 max and anaerobic thresholds, are terms that that when we do an exercise test on an individual, we can come up with values there that tell us how good or how poor physical conditioning the individual is in. But VO2 max is basically your ability to take in, transport, and utilize oxygen. So once again, the taking in of oxygen is the function of the lungs. The transport of the oxygen is a function of the heart and the blood vessels and the blood itself. And then utilization of the oxygen is what takes place in the muscles. So that's what we're measuring. And you may or may not have had an exercise test where you're breathing into a machine while you're exercising. So either on the treadmill or on a stationary bike, you have nose clips on and you have a mouthpiece, and there's a machine that you're breathing into that gives us this information and measures your oxygen uptake. And from that test also we can determine anaerobic threshold, and that refers to energy utilization during exercise and when you go from one type of energy production to another, and how that affects your breathing and so forth. But we don't need to go any further into that. Okay. Exercise, a fitness benefit is increased muscular strength and endurance, and we talked about that. So that as a result of accomplishing that, then you wind up not having to use as much effort to perform any particular tasks that you might have to do, like carrying a laundry hamper, you know, down the stairs to the laundry room or whatever. And both are important. So endurance refers to the ability to sustain a certain activity for a length of time. Okay. So being on your feet and being able to walk through the grocery store for, you know, 20 or 30 minutes, or go to the mall and walk, or to be on your feet and do some work in the yard, okay? Whereas strength refers to taking a particular task and being able to generate enough muscular force to accomplish that task. Okay, so once again, lifting something in the home, or, you know, moving a piece of furniture. So it doesn't take that long. It only takes a few seconds to do it, but you have to generate more power, if you will, to perform that particular task. So a major health benefit of regular exercise is lowering your risk of heart disease, coronary artery disease, okay? So diabetes is a major risk factor for heart disease, and regular exercise helps people not to develop type 2 diabetes. Okay? It also helps your blood lipid profile as far as cholesterol goes and triglycerides. For some reason, this didn't come out right. Exercise also helps to lower blood pressure. I've seen a number of patients, once they start exercising regularly, and they have a history of hypertension, they're on medication for hypertension, and they start exercising, and after a few weeks and months go by, and we see the blood pressure getting lower and lower. I've seen a lot of patients actually able to reduce their blood pressure medicine as a result of exercising regularly. On rare occasions, even get off of the medication. And then exercise helps to maintain a more favorable body weight, also helps with weight loss, because obviously any energy expenditure is, that energy has to come from somewhere. So if you reduce your food intake and you still need the same amount of energy to get through the day, that energy has to come from somewhere. It's going to come from the fat stores, and that's how we lose weight. And exercise also helps to increase muscle mass. Muscle is more metabolically active, so a person who has a higher percentage of muscle, they're actually going to burn more calories at rest. When we get to talking about the specifics of an exercise program, you know, we'll talk about how important strength training is, and that's one reason. Really helps with weight loss. Lower risk of osteoporosis, so weight-bearing exercise is what's more favorable to that. So exercise where you're holding up your body weight, so like walking, as opposed to riding a stationary bike. You know, walking is more favorable for osteoporosis. And of course, you have to have calcium coming in your diet, and for females, there needs to be estrogen there also to help prevent osteoporosis. Then the psychological benefits to exercise are many, as they're listed here: increased coping and self-image, increasing energy and alertness, lowering anxiety and depression. When people, a lot of people stay in our maintenance program after they go through the initial 2 or 3 months that their insurance company pays for. A lot of people stay because they like the people that they've been exercising with in rehab. There's some social support there. Exercise helps people to sleep better, and overall what we're looking for is an improved quality of life. And you know, we talked originally about longevity. Well, we want to live as long as possible, but that's with the qualification that we've got a good quality of life too. And exercise also, it helps to boost your immune system and helps you to fight off bugs and stuff that you can get exposed to. Okay, so that's all sort of a background about why exercise is important. And for people, there's some evidence out there that for people who are undergoing surgery, like chest surgery, like you do with transplants, that being at a certain fitness level actually helps with survival of the surgery, not to mention getting back on your feet after the surgery. You know, I've actually seen people who weren't able to exercise prior to their transplant, and they get the lung transplant and their breathing is just 100% better, but they're still severely debilitated because their muscles are so weak. So, you know, it helps a person to be able to get out of bed and get back on the road to recovery in a much more favorable fashion if the person's been able to exercise prior to transplant. That's always a call for the doctor though, okay, because there are certain conditions where it actually may be dangerous for you to be exercising prior to your transplant, okay. Almost all of the people we see for lung transplants, they are able to exercise. But there are certain conditions where it's not advised, and sometimes, like I said, they may be so sick that they're in the hospital on a ventilator or whatever and unable to. And certainly with heart disease also, that's always a call for the doctor to make as to whether you should be exercising or not prior to transplant. So let's talk about some general principles of exercise training now. So overload, that goes back to that slide where we were talking about stress leading to adaptation, okay? So you need to challenge yourself. If you only do what you're already capable of doing, then the body doesn't see a need for improvement to take place, so improvement doesn't take place. So if I had an individual come to me and the person is able to walk 2 miles an hour on the treadmill for 15 minutes, and I have the person spend the next 2 months walking 2 miles an hour on the treadmill for 15 minutes, they're not going to get any better. There needs to be a push. There needs to be enough stress to make that a worthwhile venture. And we like to use the word challenging. We want the exercise to be challenging. So you notice the stress that you're under exercising. That is the legs, you know, you feel that you're using the muscles and there's some fatigue there. You notice that you're breathing deeper and everything. You may work hard enough to work up a sweat, may or may not, depending on if your breathing allows you to work that hard or not. But we want it to be challenging, but at the same time, we don't want you to go home and have to go to bed for the rest of the day because you're wiped out, or you don't feel like getting up out of bed the next day because you're so wiped out from the previous day's exercise. That would be counterproductive. We want the exercise to be invigorating and to give you energy and make you feel better. Specificity refers to the fact that the body will respond to exercise according to the type of exercise that it's faced with. So, in other words, if we're talking about athletes, a runner needs to run, you know, to be in top, at a top level of competition. You know, you've got to train by running. A cyclist needs to bike. A swimmer needs to swim. So, because the muscle fibers that are recruited to do those particular movements, those are the muscle fibers that are going to get improvement, okay? So where all of that comes into play for our patients, for people with chronic heart and lung disease, is we want them to walk. You know, we can just reduce all of that to the fact that we want people to be walking as part of their exercise program, because everybody needs to walk to be able to get around and perform their daily activities. So we want, you know, walking on the treadmill or walking outdoors to be part of their exercise regimen. We do a lot of other things along with that, but walking will always be a part, you know, as long as there's not a problem with them walking. Reversibility, so unfortunately the effects of exercise wear off when you stop exercising. So it's sort of like medicine, right? The medicine only works as long as you're taking it, and after you stop taking the medicine, the effects wear off. So it's the same thing with exercise. You lose about half of what you've gained if you stop exercising for a couple of weeks, and you pretty much lose everything after a month. Strength and endurance, we already talked about the differences between those two components of fitness, and both are important. So when we start prescribing an exercise program for an individual, we have to ask certain questions. And the first question is, what kind of exercise do we want the person to engage in? So you have a lot of different opinions about this. You know, some people say, oh, walking is the best thing, and somebody will say, well, I read an article in Reader's Digest and it says swimming is the best exercise you can do. So let's just talk for a few minutes about that. Anaerobic activity is activity that's done in spurts. It's done at a high intensity. You're going all out, but because you can only last a few seconds going all out, it means the activity is done in a stop and go fashion, okay? So most of the sports we play are anaerobic. You know, think about baseball. You swing the bat, hit the ball, you run full speed to first base, or as far as you can get, you know, and then you stand on the base while the pitcher's pitching to the next batter. So there's a built-in rest because you can't just run all out indefinitely, okay? Same thing with football. A play lasts for 7 or 8 seconds or so, and then you're in the huddle and there's a rest period there. You walk to the line of scrimmage, the next snap, and so forth. Some activities combine all-out movement with slower movement, and they get their recovery in the slower movement. So basketball is an example of that, soccer. So there may be continuous movement, but there's these bursts of high energy, okay? So those are the kinds of activities that we participate in, when we're younger and all, but as we get older, it gets more and more difficult to participate in those types of sports because of the stress on your muscles and joints in performing those types of activities. So for adult fitness and for rehabilitation, what we usually do is focus on aerobic exercise. So aerobic exercise is continuous, it's done for an extended period of time, and therefore you have to find a slower pace so that you can last for an extended period of time. And that provides less stress against your muscles and joints also. And it's very effective for improving that muscle endurance that we talked about and cardiovascular endurance. So what kind of exercise is best? There's a list of aerobic exercises up here. And basically, all of these are effective, so it really comes down to preference on your part. Okay, what is it that you like to do and will do on a regular basis for life? Okay, there's some other things that we might want to consider too. Some activities require a certain level of skill, and if you don't have that skill level, then you won't last very long doing it. So it might be better for you to choose something else. So like swimming, if you don't have good swimming technique, you're not going to last swimming for 20 or 30 minutes, right? You're going to poop out in just a few minutes. Cross-country skiing is another one. So there are those considerations. Also, what do you have access to? Do you have access to a swimming pool? Okay. Do you have a Nordic track in your home, or can you get outside on a regular basis on a cross-country skiing course? So another thing to consider is orthopedic issues. Okay, is it wise for an individual to be jogging when they have certain orthopedic injuries or chronic conditions? As we get older, a lot of us get rotator cuff problems. So even though swimming is very low impact, it's not good for those of us who have shoulder problems. Okay, so those are all things to consider. But basically, what do you like to do? And you feel like it's something that you won't get bored with, and you'll be able to do for for life. And do you have access to it? Okay, when you live in a hot weather climate or cold weather climate, you really want to look at having a piece of exercise equipment in the home. Okay, because the weather will have an effect on your ability to exercise on a regular basis. If you live in the South or somewhere where it's hot and humid during the summer, you don't want to look at a scenario where you're just not going to be able to exercise for 3 months at a time. It's just not very good. And same thing, of course, for the winter climate that we have here. Also thinking about inversion and during the summer, smoke coming into the valley from forest fires, whatever. So those are all considerations. We tell every person who comes through pulmonary rehab at their orientation, their very first session, if they don't have exercise equipment in the home, we tell them they need to start thinking about acquiring something, because we're going to eventually get them on a home program and want them to start exercising at home. Okay, so once we've established what type of exercise the individual is going to choose for their exercise program, then let me back up a step. Walking is one of the most preferred. Okay, there's no special skill required, and people just tend to stick with that longer than some of the other things. Okay. When you compare the cost of a treadmill to a stationary bike, treadmills cost a lot more, but people don't tend to stick with stationary cycling. They complain about the discomfort of the seat or the boredom of just sitting there and the legs spinning, turn after turn, whatever. So people just don't tend to stick with the cycling as well as the walking. So walking is probably the most popular activity as far as keeping up with exercise over the years. Okay. Yes.
Can I ask a question?
Sure.
So rowing, I actually like to row, but rowing, are you using as many muscles or more muscles than you might if you did some of the others?
Sure. In fact, maybe more, you know, compared to walking, because obviously you have to use the upper body muscles too. So with swimming and rowing, cross-country skiing, we have a machine in both pulmonary rehab and cardiac rehab here called a New Step, where you're seated and your feet are out in front of you and you're doing a stepping motion with your feet, but also pulling levers, pulling and pushing levers back and forth. So for all of those types of activities, you're using upper body muscles as well as the leg muscles. So yeah, it's an excellent form of exercise, any of those. Okay, so the next question we ask after what type of exercise do I want to do for my program, the next question is, how hard do I need to work in order to create that stress? So we're asking about exercise intensity here. Everybody who comes through pulmonary rehab pretty much has an exercise test. So we need to do some kind of cardiac evaluation coming into the program to make sure it's safe for the individual to exercise. So unless they've already had some kind of more involved cardiac workup, like an echo, a stress echo, or a cath or something like that, we do an exercise test. And we derive a target heart rate from this exercise test. So that's a heart rate range where we want the individual to be working in to make sure that they're working hard enough, yet not too hard where it might be dangerous or counterproductive for the individual. So we come up with a lower number and a higher number, and we want their heart rate to be in that range while they're exercising. Okay? So the only way to really get that is to do an exercise test. There are formulas out there for the healthy or apparently healthy population. You know, all kinds of exercise books refer to formulas that you can use for that. But working with people with a chronic illness, we don't want to resort to a formula. We actually want to do an exercise test and determine that. Okay? Then we also use this scale called the Perceived Exertion Scale, and we refer to it as RPE, Rate of Perceived Exertion. So what we're doing is asking the individual, in the blue letters up there, how hard are you working? How hard do you feel like you're working? This is an inner feeling of exertion, taking into consideration leg fatigue, how hot you are, if you're nauseous, what your breathing is like, all of those things. We're asking, how hard do you feel like you're working? And a 0 is no exertion at all. All of us right now are a 0, okay? 10 is the hardest exercise you've ever done. So we ask the person to give us a numerical value as to how hard they feel like they're working. And you can go in between there too. You can say a 3.5 or a 5.5, whatever is appropriate. And we like for people that we see to be in this 3 to 5 range, which is moderate to hard, okay? Most of the folks we see, you know, it's going to be a 3 to a 4, moderate to somewhat hard. Some people are healthier and can push themselves a little harder, or some people are more motivated and they want to push themselves a little harder and might reach a 5. Or the nature of a chronic illness too is that you have good days and you have bad days. So you may be working at the same speed and one day feel like you're a 4, but the next day feel like you're a 5. So So we like to see people in that range there. If they are consistently giving us a 2, saying that the exercise is easy, then we might reevaluate what their exercise intensity is and bump it up so that they're working harder. By the same token, if they're telling us it's a 7, then we don't want a person working that hard. However, you do have to make sure the person's interpreting the scale in the proper way also. There are some people who may act like you're killing them, they're giving a 7, but you look at their heart rate and blood pressure and all during exercise, you just look at their face and you can tell they aren't working that hard. And vice versa, you may have some people who are consistently giving you a 2, but they're knocking themselves out and they're just underestimating the scale. So sometimes it takes a while for the patient to get a handle on the scale, and so that we're communicating to each other appropriately here. Then the next question, after we determine how hard the person's going to be working, and we use those two things in conjunction. So with the heart rate and taking a blood pressure during exercise, we get objective measurements, okay? But we also want the subjective input from the patient too. So that's where that RPE scale comes in. And then in addition to that, what about when the person's exercising at home? It might not be as easy for them to check their heart rate as it is for us, because for us, we may have the person on an EKG monitor and we're getting a continuous reading of their heart rate, or we put a pulse oximeter on their finger and we get the pulse there. So if a person doesn't have a pulse ox at home, or doesn't have a treadmill or a bike where there are handles, electrodes there that they can grip and get the pulse sensed from that. If a person has to rely on taking their own pulse, then they may not be able to do that. Some people just have a hard time doing that. So they can use that RPE scale. If they've been in rehab and they're able to associate how hard they feel like they're working with that scale, and they can use it accurately, then they can use that scale when they're exercising on their own and not have to always be worrying about taking their pulse. The next question is, how long do I need to exercise for? Okay, what is the duration of each exercise session? So we say usually, standard is to say 20 to 60 minutes, depending on the goals of the individual, okay? Obviously, people with chronic disease may not be able to start out with 20 minutes, or at least not 20 minutes continuously. A lot of folks we see, we start them off at 15 minutes, okay? Some people we see can only exercise for a few minutes at a time and need to take a rest, okay? So that cycle of inactivity that we showed with that first slide, if we have somebody come in who's really at the bottom of that spiral, they come in a wheelchair, and they might only be able to walk 3 minutes on the treadmill before having to stop and take a break, catch their breath, let their leg fatigue subside, and then we have them do another 3 minutes, sit down and rest, do another 3 minutes. So they may get their 15 minutes in short intervals like that. We do that often too. But we're always going to be working towards a longer duration and being able to do the exercise continuously for at least 20 minutes. Most of the patients we see, we have a goal of being able to exercise 30 minutes continuously. With lung disease, you have a lot of people who we really don't want them to lose weight. Okay? Their lung function is so bad that they use a whole lot of energy just breathing. Every breath they take takes a lot more energy than it does for those of us who aren't saddled with that kind of problem. So we don't want them exercising for too long, or we want to make sure that they're able to subsidize their exercise with enough caloric intake so that they don't lose weight. But there are other folks that we see that are overweight, and if they were able to lose 20 or 30 pounds, then it would be a lot easier on their breathing, so that their leg muscles don't have to carry around that dead weight. So like I said, depending on the goals that we have for the individual, it'll be anywhere from 20 to 30 to 60 minutes, and most of the people we see, it's a goal of 30 minutes. The frequency, they're coming to pulmonary rehab or cardiac rehab 3 times a week, okay? So that's the minimum. And then after a time with us, usually after a month or so in the program, we have them start exercising another couple of days a week at home, okay? So they're up to 5 days. Then for some people, we may encourage them to exercise 6 or 7 days a week, depending on, again, if a lot of weight loss is desired for that individual, or if diabetes is involved and they want to be consistent with their energy expenditure and with their caloric intake and everything, we may have them exercising every day. Then progression. Like I said earlier, you don't want to have the person come in, start at a certain level, and then just stay at the certain level of exercise. As time goes on, we're going to increase the duration that they're exercising, and we're going to increase the intensity. So in order to keep the exercise challenging, we have to increase treadmill speed or the resistance on the bike or whatever, and we're going to increase the duration in order to get up to that 30 to 60 minutes of exercise. So we always do that slowly though. So we may increase by 3 to 5 minutes a week until we get to their goal. And as far as speed goes on the treadmill, we usually only increase it by 1/10 or 2/10 of a mile per hour. So going, if they're walking at 1.5 miles an hour, the next jump might be to 1.7 miles per hour or 1.6 miles per hour, okay? We usually have the person increase speed until they get to a point where they don't feel like it would be comfortable to walk any faster, that their stride just doesn't allow for any faster walking, and at that point we start adding elevation, start going uphill, and we add just 1% at a time when we make those increases. If they're on a stationary bike or the new step, we increase by about 5 watts, or on the new step about 10 watts. With the bike, they're only using their legs, so the increases are only 5 watts at a time. With the new step, since they're using arms and legs, we usually do 10 watts there. Okay, so all of that I've been talking about up to this point refers to the aerobic exercise. So that's the biking or the walking or stair stepping or swimming, whatever. But now we need to address the strength training. So the other stuff was referring to aerobic or endurance training. Now to speak about strength training, we need to talk about resistance. So the muscles need some kind of resistance to work against in order to increase strength. So that can be accommodated by using hand weights or weight machines like you see in health clubs or like we have in our rehab programs here. You can use those bands, those TheraBands or other resistance bands. All of those things will provide a resistance. Okay. In water aerobics classes, people will use these containers, with the water, and you can, use that. So basically, any resistance that you can put against the muscles can help to build muscle strength. Okay, and typically, what we want to do there is just exercise 3 times a week. 2 to 3 times a week, and on alternate days. The aerobic exercise you can do 5 days a week or 6 or 7, okay? But with strength training, because you're pushing muscles more to their capacity, you want to have a day off in between and not do the strength training on a daily basis. So we see people in our 2 programs here, cardiac and pulmonary rehab, we see the patients on Monday, Wednesday, and Friday. So they'll do their weights along with the aerobic exercise on Monday, Wednesday, and Friday. But they can do aerobic exercise at home on the rehab off days, but we don't have them do strength training on the rehab off days because it needs to be on alternate days. And then we divide the exercises up into what we call sets and repetitions. So a set is when you do a particular type of exercise for so many repetitions, okay? And really, for adult fitness, all you need to do is 1 set or 2 sets. You will get some improvement doing 2 sets rather than 1. But going up to 3 sets, there's not that much improvement to be derived going that extra set. So, 1 to 2 sets is really adequate for adult fitness. And each set, about 10 to 15 repetitions. Okay? So the amount of weight that you're using is important because you want to work that muscle, that muscle group to a point of fatigue by the end of that set. So in other words, if we have a person who's doing 2 sets and they do 15 repetitions in that first set and then they don't even need a break, they just go right on and do the next set of 15 repetitions right on top of that, we would say that the weight is too light for the individual. That it'd be more beneficial for you to use a heavier weight and have to stop, you know, after 10 to 15 repetitions. Have to stop, let the muscles recover for a little bit, and then do your next set. Or what you can do is go from one exercise to another and then go back and repeat so you get the second set that way. Okay, so here is a typical aerobic exercise prescription. We always start with a warm-up. You never want to go from the resting state to just jumping full speed into your exercise. Okay, we do a warm-up for 3 to 5 minutes, typically at an easy pace. So if you're looking back at that RPE scale, that would be a level of 1 to 2, which is very easy or easy, you know, speaking subjectively. And so if you have a treadmill at home and this is your home program, we might have you warming up for 3 minutes at 1.5 miles per hour, okay? And then after that 3 minutes, you increase the speed to whatever we have prescribed for you, say 2 miles an hour. So you do that for your 20 minutes or so, whatever you've worked up to, 20 to 30 minutes. And hopefully, at that speed, what we're looking for is for the exercise to be considered moderate to somewhat hard. That if you look at that range, that RPE scale, you would rate it as a 3 or 3.5, a 4, maybe a 4.5. And like I said, some people are more motivated and push themselves a little more to a 5. But what we would see also is when you're reporting that it's a 3 or a 4 or a 5, that you're also within your target heart rate range that we have derived for you from your exercise test. So you're going at that rate for 30 minutes or so, that 2 miles an hour, and then you go into your cool down. So you slow down back to that 1.5 miles per hour. It's an easy pace for another 3 to 5 minutes before stopping. You never want to be working hard and just slam on the brakes and just stop. Okay, you want your system to slow back down, let your heart rate and your blood pressure start returning to normal before just stopping abruptly. So this is what a weekly schedule may look like for one of our patients who's been with us for a couple of months. On Monday, Wednesday, and Friday, they're coming into rehab, and we would call that their hard day because they're doing the aerobic exercise and the weights. Another thing too, when we go back to the modalities, and we talked about boredom and we talked about specificity, we usually have people do a couple of different types of aerobic exercise. We always use the treadmill unless they have some orthopedic issue that prevents us from doing that. But then we'll use another type of exercise too, like a stationary bike or the new step or the Stairmaster or something like that. So they may do a 3-minute warm-up, do 15 minutes on the treadmill, then do 15 minutes on the new step, then a 3-minute cool down, okay? But whatever the aerobic exercise of choice, they're doing that on Monday, Wednesday, and Friday, and they're doing the weights, okay? So we have weight machines and we have hand weights that a person might use for their strengthening program. Then the easy days are at home, and we put the easy days in on, say, Tuesday and Saturday. So you see they never have 2 hard days in a row. On Monday you have a hard day followed by an easy day on Tuesday, hard day on Wednesday. Then Thursday can be an off day where they don't exercise at all, or they do another easy day. Okay, and then hard day on Friday, easy day on Saturday, and then take Sunday off. So that's a typical schedule for our patients, and it seems to work really well. And then we tell them if they have some kind of errands that they need to run or housework that's particularly difficult, that they could do those on their off days, okay, instead of trying to do that, you know, follow up an exercise session at rehab with later in the day doing, you know, going grocery shopping or something that might be really too difficult for a lot of our patients to do. Okay, some signs of exercising too hard: when you actually have to stop the activity because of your shortness of breath. Okay, you don't need to push yourself to that point for the exercise to be effective for you. All right, if the exercise causes you to have a headache, get dizzy, or feel nauseous, that may mean that you're pushing yourself too hard. Okay, chest discomfort. Okay, if a person has heart disease and angina is part of their life, we want their exercise to be below that angina threshold. Okay, so if we determine from an exercise test that a person's angina comes on when they reach like 120 beats per minute, then we would make the target heart rate below that so that they don't reach that angina threshold. So if you are getting chest pain, you know, then you need to be exercising at a less intense rate. Feeling your heart just racing, taking off. We know that the heart rate is going to increase during exercise, but we want it to be a normal type of heartbeat at an elevated level. We don't want it to be an arrhythmia. So if a person's heart is just really racing, or if they feel palpitations, then those might be indications to reevaluate what the person's doing for exercise. A lot of people have palpitations, and it's just, you know, it's normal for them and it's no big deal, but we want to make sure that that's documented and the doctor knows about it and everything before continuing on. We don't want the individual to feel persistent fatigue or sleeplessness. You know, if you have trouble sleeping on the nights that you have an exercise, you've exercised, then that might mean that you've pushed yourself too hard, okay? Or just feeling run down. Like I said earlier, we want the exercise to invigorate you, make you feel better, give you energy. Persistent muscle soreness too, we would want to take a look at what's going on there, that shouldn't be the situation there. Okay, some precautions: don't exercise right after eating. Okay, your body is actually competing for blood flow depending on what the activity is. When you're exercising, then more blood is focused on the exercising muscles. After a meal, more blood flow is directed to the gut area to carry away digested food nutrients and everything from your meal. So if you try to exercise right after eating, your body's really competing for blood flow, and neither one, digestion nor the exercise, goes very well. You don't want to exercise if it's too hot outside, because your heart and your cardiovascular system plays a large role in heat regulation in your body. And if you're trying to exercise when it's too hot, then once again, you're competing for blood flow. The muscles want the blood flow because they're working so hard, but the skin wants the blood flow also to aid with getting rid of the heat from your body. If it's too cold outside or really windy, then that obviously can affect you. If you're trying to walk and you're walking into a stiff wind, then obviously there's more resistance there. So that's going to make it more difficult. And then cold air can also, in some people, can cause their airways to close down, to constrict a bit. Illness. Usually what we say is that if you just have a cold, it's okay to exercise, okay? If the symptoms are from the neck up, it's okay. But if it's in your chest, then it's probably prudent to wait a few days and let the infection clear up. Okay, mostly you want to listen to your body and just ask, is it reasonable? You know, you don't want to take it too easy on yourself and give yourself any reason to not exercise, because that can be habitual. But at the same time, you don't want to be so gung-ho with the exercise that you're not being prudent there. So just ask yourself, you know, would it be best if I just kind of lay off for a day or two, or should I go ahead and try it? What I'll tell people a lot of times, you know, they'll call and say, this is what I'm feeling, I don't know if I should do it or not. What I'll say is, get on the treadmill and do your warm-up, and maybe do an extended warm-up. So instead of just warming up for 3 minutes, maybe warm up for 5 or 7 or 10 minutes, and see how you feel after getting things going. And, you know, maybe you continue, or maybe you say, no, I just really feel lousy and I'm going to bag it for the day. Okay. Or maybe if you're not feeling well, there's no rule that says when you get on the treadmill you have to go that same speed. If you're not feeling well, just cut back a little bit. Cut back on the time that you're exercising and or the speed, intensity that you're exercising. Make sure that you report new symptoms to your doctor. So if you start getting chest discomfort, or it becomes more frequent, or it starts coming on, it takes a lower amount of exercise to cause chest discomfort to go on, that's something you really want to let your doctor know about. If you're retaining fluids and you've got a sudden gain in weight, or notice your ankle swelling, then your doctor needs to know about that. Increased dizziness, lightheadedness, an increase in your coughing or the color of your sputum, that can indicate an infection, persistent aches, fever, all of those things. New onset of those things you want to report to your doctor. Okay, sticking with it, the most important thing you can do to be consistent with your exercise is to actually schedule it. Schedule it with yourself and say, this is the time that I have devoted to my health, and I'm not going to let anything get in the way here. So if you've been going to cardiac rehab or pulmonary rehab at 9 o'clock in the morning on Mondays, Wednesdays, and Fridays, when you graduate, you know, you might want to keep that same time, because you've already gotten in the habit of and have set that time aside for you. But the most important thing is to set that time. You don't want to wake up and say, oh, today's Monday, so I need to exercise sometime today, because you know what happens. You get caught up in life, one thing after another, you know, and before you know it, it's 7 o'clock at night, and oh, I really don't feel like exercising now. It's too late, you know. So you want to schedule it. Exercising with a partner is really effective to help you stick with it. So whether that's a spouse or one of your kids or a neighbor, again, that's also part of the scheduling yourself too, making it part of your routine, making it something that, you know, a commitment that you're making towards your own health to make sure that it gets done. A lot of people like to be distracted, especially with stationary equipment. A lot of people get really bored with, you know, treadmills and stationary bikes and all. So watching TV in pulmonary rehab, we have the TV on all day on Mondays, Wednesdays, and Fridays, and people like to watch the different shows and you know, our sports on TV, you know, or listening to music, reading, whatever. All of those things can make the time go by really fast. If you're going to be exercising for half an hour, you know, put on the TV. A sitcom is half an hour, and it can make it fly by. We talked earlier about having some type of exercise equipment in the home, so a treadmill or a bike. That helps, as opposed to a lot of times what I'll hear is when the person's in for the orientation and I ask them if they have any exercise equipment, they'll say, well, my sister has a treadmill and she told me I can come over anytime and use it. That usually doesn't work out well. You know, are you really going to go to your sister's house 3 times a week and, you know, spend an hour there doing that? You know, usually not. So having something at home, there are a lot of these senior centers around town, so that's great. Having a health club membership, whatever. We have and cardiac rehab has also what we call a maintenance program. So people who graduate, you know, whatever it is that their insurance company has paid for, and usually it's 2 months or 3 months of rehab. We invite people to continue on with us, and it's a self-pay program because insurance, they want to pay for you to get better, but they don't want to pay for maintenance. Okay, so after that period, well, that's what they say anyway. However, it works out sometimes with the billing and everything is another story, but typically, that's what an insurance provider will say is, well, okay, you have this disease process, and we realize the benefit to rehabilitation, so we're going to pay for you to get that. To get rehabilitated, and part of what we expect from the rehabilitation team is to teach you how to maintain that after you finish with them. So then you're on your own. So if you want to join a health club or do the maintenance program in rehab, then you're going to have to pay for that yourself. And it's a reasonable situation there. So we have people who've been with us for years and years and years. And I know cardiac rehab has the same situation. Now, this last point I'm going to make is just really important, and I just really need to emphasize this. If you get away from the exercise, don't expect to just be able to jump back in where you left off. And this is one of the biggest problems we have with people maintaining an exercise program at home. They fall victim to this trap right here. We see our patients, even if they're not coming back for rehab, we see them for years to come because they keep coming to the clinic to see our doctors here, and they come down to the pulmonary lab to do pulmonary function testing and stuff. So we see them, oh, how are you doing? How are you keeping up with your home exercise? And I hear this so often. Well, I did really good. I stayed with the exercise after I left rehab. I stuck with it for about a year, and then I caught a really bad cold, or I got pneumonia, or I caught the flu, and I was just never able to get back into it. I couldn't exercise for a couple of weeks there because I was so sick, and when I went back to it, I just couldn't do it anymore. And what you need to do is just cut way back in those kind of situations, you know. So reduce the speed, reduce the duration, and you hopefully don't have to start all over again, but if you do, so what? You know, it's okay, you know. Do whatever you can accomplish comfortably and work your way back up just the way we worked with you in rehab, increasing, you know, progressing you a little bit at a time as far as duration and intensity goes until you get back up to where you were. But don't just expect to just jump in at the same speed. So that goes for whether you got sick and had to back out of exercising for a while, or if you just got non-compliant. You know, maybe you went on vacation and didn't exercise for a couple of weeks, and then when you came back you just felt kind of lazy. Whatever the reason is for the layoff, you want to approach it the same way, coming back really slowly. And I think that's it. Okay. So, any questions?
When I had my transplant, I wasn't in great shape before, but I had been coming to rehab for several months before transplant. And then after transplant, I developed something they called critical illness myopathy, where I had virtually no movement at all in my lower body and had to start from scratch learning to walk. Do you have any idea what causes that? What would cause that to, I mean, I know everybody that I've seen come back from transplant, except Julie, seems to have some loss of function in their lower body, but to, you know, lose it completely that drastically. Do you know what the mechanics of that is, why that happens?
No. There's such a spectrum of muscle function that we see after transplant. We see patients who are like you, and you know, you've seen at least a couple of other people, maybe not quite as bad as you experienced it, but certainly that real profound muscle weakness. You've seen a couple of those guys. And then we have other people who just get right out of bed and they can just take off. You know, they can walk laps around. You know, really the thing that's holding them back more than anything is, you know, the incision and having all the IV pole with everything they're attached to, and all of that is slowing them down more than anything. So it's really an enigma as far as I can see, as to why that happens, because you were in rehab for, you know, a long time leading up to that, and able to do a fair amount of work where you wouldn't expect to see something like that happen. You know, I said earlier that I had a patient who was in the hospital getting like 300 milligrams a day of solumedrol just to be able to breathe. And then he got transplanted, and so between the bed rest and the corticosteroid influence on the muscles, just had such profound weakness. So something like that you can understand, and there's a, you know, a rhyme and reason to that. But I don't know. I don't know if there's any way to identify. You know, I don't think there is any way to identify a patient who might experience that.
The really wonderful thing, though, was that it came back. I mean, I probably would have bet money with Dr. Cahill that I was going to be debilitated for the rest of my life because I was so weak. But, you know, between the inpatient rehab and then coming back to pulmonary rehab, I was really proved wrong. I mean, I was able to get it back. And she kept telling me it would come back, and I didn't really believe her. So
yeah.
think that's a proof that no matter how far down you get, you can come back.
Mm-hmm. Yeah, I don't know if it's you know, related to how long the surgery takes, and you know, if the person's on bypass or not, and how much less oxygen there is going to those muscles, you know, during the time that the surgery is taking place. I don't know. Okay. Any other questions? Okay. Thank you.
You explained it so well.